This technique article describes the treatment of a failed lateral meniscus oblique radial tear using a segmental meniscal allograft transplant. This case was performed at the Stedman Clinic in Vail, Colorado. This patient is a 16-year-old female presenting with left knee pain and mechanical instability after an acute injury while sliding into first base on a hyperextended knee. She continued to have recurrent effusion with medial joint line tenderness, and therefore an MRI was obtained. MRI demonstrates an oblique radial tear of the lateral meniscus about 5 millimeters from the posterior horn with displacement and also suspicion of discoid appearance of the lateral meniscus. Due to the complexity of the tear pattern and defect adjacent to the meniscal root, the patient underwent segmental allograft meniscal transplantation. An arthroscopic probe is used to assess the instability and tissue quality of the posterior horn lateral meniscus tear, which is noted to be less than 5 millimeters from the root of the lateral meniscus. Furthermore, the lateral meniscus appears to have a discoid appearance, which is unstable upon arthroscopic evaluation with a probe. A combination of an arthroscopic biter and shaver are used to debride the meniscal tear back to healthy tissue and a stable rim. A meniscal root repair guide is utilized to drill a tunnel with a cannulated guide pin from distal medial to proximal lateral at the footprint of the lateral meniscus posterior root. Next, a fiber stick suture is passed through the cannulated pin and retrieved through the arthroscopic portal to facilitate passage of the meniscal allograft. Meanwhile, on the back table, a fresh allograft lateral meniscus is sized and prepped for transplantation. A segmental allograft is excised from the cadaver and fiber wire suture is placed through both ends of the meniscus in a vertical mattress fashion. The meniscal allograft is then introduced into the joint from the anterior medial portal and positioned under direct arthroscopic visualization at the prior resected footprint of the lateral meniscus. The previously placed fiber stick suture is then used to pass the posterior medial fiber wire suture attached to the meniscal allograft through the previously drilled tunnel at the meniscal root. Next, two fiber stitch all-inside implants are additionally used to secure the allograft to native meniscal tissue along the rim of the segmental meniscus. An inside-out meniscal repair is then performed to secure the meniscal allograft to the remaining native meniscal tissue and capsule. An inside-out meniscal repair is then performed using a zone navigator to secure the meniscal allograft to the remaining native meniscal tissue and capsule. Finally, the suture that was previously shuttled through the root repair tunnel is fixed with a single swivel lock anchor, ensuring appropriate tension on the meniscal allograft.